Welcome to the Dr. Dare Show. My name is Dr. Frederick Dare. I am a therapist here in Atlanta, Georgia, and welcome to my channel. But before we get started, make sure you subscribe to my YouTube channel. Yes, subscribe. Make sure you like this video, share it, and click the little bell at the bottom of the screen so that you will get updates of when I upload new content. We usually cover hot topics or mental health issues. Today is no different. Today, the topic is, would you take the COVID-19 vaccine? Why or why not? And so the reason I thought to talk about this is because we all have been hearing on the news that there's like two companies, Moderna and Pfizer, who say they have like over 90% success rate with this vaccine. But I'm hearing a lot of people around me and people just online questioning whether they're going to take this vaccine or not. And so I wanted to do just a little quick video. I'm not a vaccine expert by any means. I am not promoting the vaccine. I don't know anything about it. I just wanted to talk about it because I think it is important to talk about this and understand what the vaccine is and how many trials that this vaccine has been through, and make that decision. Because even at my local Walgreens store, I see a sign that says COVID vaccines are not available yet. So apparently people are running to the stores and the pharmacies and trying to see if this vaccine is available. And I know why, because we are living in this crazy pandemic, and it's very scary. The last numbers that I looked at, it was 12 million cases of COVID, and then 256,000 deaths. And in the whole world, there's about 1.2 million people have died from COVID. So a lot of people are in that panic mode, and as these numbers increase daily, we all get a little fearful. We're all tired of being in the house, but this is our reality right now. And so I just thought, I would just do a little information sharing on a vaccine and the development process. So what I've seen is the vaccine testing process. There's like three phases. Phase 1 is safety trials. Phase 2, expanded trials, and phase 3, efficacy trials. But there is a preclinical testing, so we'll start there. It starts with clinical testing, and that's where the scientist gives like the animals, such as mice or monkeys, they give them the vaccine to see if it produces immune response. And they have confirmed 87 preclinical vaccines in active development. We have confirmed 87 preclinical vaccines in active development. So I guess that's where it starts. And then phase 1 is safety trials. That's where the scientists give the vaccine to a small number of people to test for safety, to test for dosage, as well as to confirm that it stimulates the immune system. This stuff is scary, right? Phase 2 is the expanded trials. This is where scientists give the vaccine to hundreds of people, and they're split into groups, such as children and the elderly. So they split this at this phase 2, they split the groups into two, like elderly and then children, and to see if the vaccine acts differently in them. And these trials further test the vaccine safety and ability to stimulate the immune system. So that's phase 2, and then third phase is the efficacy trial. Scientists give the vaccine to thousands of people and wait to see how many become infected compared with volunteers who receive the placebo effect. These trials can determine if the vaccine protects against the coronavirus, and in June the FDA advised vaccine makers that they would want to see evidence vaccines can protect at least 50% of those who receive it. In addition, phase 3 trials are large enough to reveal evidence of rare side effects that might be missed in early studies. So this one, phase 3, they can capture the side effects. They can, it needs to be, according to FDA, it needs to be the vaccine needs to be 50% effective. Moderna and Pfizer has one that's over 90% allegedly, and I know a lot of people are fearful. So those are the 3 phases basically, and then there's these approval steps. Early or limited approval, like China and Russia have approved vaccines without waiting for the results of phase 3 trials. So I guess the process is you go through these 3 trials plus the preclinical testing, and then you determine whether it's approved or not. So China has jumped the gun and said early or limited approval. China and Russia have approved vaccines without waiting for the results of phase 3 trials. Experts say this rush process has serious risk. Approval is the next step. Is regulators in the country review the trial results and decide whether to approve the vaccine or not. During a pandemic, a vaccine may receive emergency use authorization before getting approval. Once a vaccine is licensed, researchers continue to monitor people who receive it and make sure it's safe and effective. And then, there's the combined phase, and that phase, some corona vaccines are now in phase half trials, for example, in which they are tested for the first time on hundreds of people. Note the tracker counts a combined phase trial as both phase 1 and phase 2. So I think the accelerated version is that you're in phase 1 and phase 2 at the same time, simultaneously paused. And that's the last step. If investigators observe worrying symptoms in volunteers, they can put a trial on pause. So these are the steps I'm assuming Moderna and Pfizer has went through. And something I found interesting, there's still a lot of people saying they don't do vaccines, like they don't do the flu shot, they don't do any of those things. I do the flu shot every year. I haven't had any issues, thank God. I don't know if I'm going to take this. I'm doing a little research, reading to understand what this is all about, and I just wanted to ask the question: do you think you're going to take the vaccine out there? A lot of people are worried. They feel like it was rushed. Because usually these types of vaccines, the development and all that stuff, take years and years and years. But with the numbers going up like crazy, and we're all living in fear, and we're all not understanding what is going on in our world, a lot of people felt like this got politicized, and they don't want to get in the middle of that because they felt like it was rushed because of that. But one thing that I did find interesting, so like with the flu, usually they inject you with like a weakened or dead version of the virus. They're saying that with this coronavirus, according to all my information came from the New York Times, by the way. According to the article that I read, this vaccine is just a snippet of the virus's genetic code to instruct cells to build a spike protein on the surface of the coronavirus, teaching the immune system to recognize the virus. So it's like a snippet of the coronavirus. I don't really know what that is. I'm not scientific. Like I said, I'm not here to go all into details. But I'm going to continue to research this to see what it is. I don't know if I'm going to take it or not. Let me know your opinions. Are you scared? Are you going to just be natural selection if the coronavirus gets you and you die? Is that okay with you? It's something to think about. Instead of just saying that I'm not going to take this vaccine, but you have no rationale behind that, no support of that, lack of support, any of that. You want to do due diligence and for yourself and your family and see if the vaccine is worth taking. I'm not saying no, I'm not saying yes, I'm saying I'm researching. So I just wanted to do this video. Thank you for checking out my video. Check out my other shows. I do a lot on depression and anxiety. I know we're having a tough time. Now with these numbers going back up, we're being isolated again by ourselves and having to do things by ourselves, and holidays are coming up and you can't really go see your family like you want to. all of those things can trigger depression and anxiety and all of that stuff. So check out some of my other videos. Thank you for listening to this one. Let me know your thoughts. Are you going to take the coronavirus vaccine? Why or why not? Are you afraid? Is it political? Is it what? Tell me your reasoning. Oh, one thing I did want to discuss. So they're saying, like in order of importance, that they would probably be inoculating healthcare workers and emergency healthcare workers and all of those people before they start with the rest of the population. And yeah, let me know your thoughts on that. All right, I'm out.